Okay guys, so this video is about some of the named classification of different things like your fractures, about your nerve injuries, about the tumors. Let's talk about the important ones. If I mark the first one, the first important classification you can remember is from here, the fracture proximal humerus, and that is what you classify as needs classification, right? So 1 part, 2 part, 3 part, 4 part, that is how needs classified. Displaced fractures are defined more than 1 centimeter and 45 degrees of angulation. Second most important classification is from this area, that is supracondylar area, and you know what you call, how you classify that? It is by Gartland's classification. That is Gartland's classification, type 1, 2, 3. Some literature mentions 4 also, but 3, that is what we usually remember from our classroom, right? Below that you have one important classification here, that is of the lateral condyle, and that classification is Milch classification. That is Milch classification. It is classifying the fractures around the lateral condyle, type 1 and type 2. How it classifies is type 1 and type 2, and sometimes often I get some questions that type 1 is Salter-Harris, type 2 or 4. See, Milch classification, it defines the lateral condyle fracture into 2 grades, and this second one is more common, and this one is Salter-Harris type 2 injury. This one is Salter-Harris type 2 injury, which is seen in 95% of the children. So more common is type 2 of the Milch, which is again Salter-Harris type 2 injury. Okay, below that you have, after Gartland and Milch, you have this ulna, proximal ulna. Right, proximal ulnar fractures, how you classify them? It is by Bedo. And what do you call the fractures of the proximal ulna? That is Montegia fracture. So Gartland supracondylar, Milch lateral condyle, and Bedo is for Montegia, defining the classification according to the direction of radial head dislocations, right? So these are important ones here. One here that you, if you want, you can remember, else there is no such importance. The lower end of radius, it is classified by Frickman or Fernandez classification. There are others also. So Frickman or Fernandez classification, that is for lower end of the radius. If you go more down here in the pelvic area, the fracture of the pelvis, it is classified by Tiles classification. Here it is Tiles classification. Another one can be used, Young and Burgess. This one is simpler one, the Tiles classification. When you move more down here, around the neck of the femur, or the proximal femur basically, here we have two types of classifications. One which is related to fractures, right, and other one which is related to dislocations, right? So one classification system related to the fractures of neck of the femur, and other is about dislocation of the head with fractures. How we classify that, right? So when you talk about the fracture neck of the femur, the classification system used, they are basically 3 simple ones. Number 1, you all know, the anatomical classification, the subcapital, transcervical, the basicervical. Second one, the Powell's, which is according to the angle between the fracture line and the horizontal line. And number 3 is Gardens, which is based on the arrangement of trabeculae in the acetabulum, head of femur, neck of femur. When there is a fracture dislocation, this is classified by Thompson-Epstein classification. That is Thompson-Epstein classification, and a part of which is Pipkin's classification, right? So these are around the proximal femur. So when you talk of the proximal femur, this is how you classify them, the tiles here. Other important classification that you may, if you have read something more in orthopedics, that is about osteonecrosis here. So osteonecrosis of the femoral head, osteonecrosis of femoral head, it is classified by Fickett and Arlett classification. The Arlett and Fickett classification, which basically considers the combination of the symptoms, radiological finding, the bone scan, the pathological findings, biopsy, all those things are considered here, right? Now, after these common injuries, what more you can learn is the fractures if there is any open fracture, right? And I hope all of you know by this time what is an open fracture. So classification for any open fracture, what is that? I know all of you already know the answer. It is Gustello-Anderson classification. So for open fractures, it is Gustello-Anderson classification, right? The similar way, if you have the infections, chronic osteomyelitis, let's suppose here the metaphyseal area of the bone. For osteomyelitis, the chronic osteomyelitis basically, for chronic osteomyelitis, the classification used is Cierne and Maeder, the Cierne and Maeder classification, right? For the tumors, to classify them as benign or malignant, the classification being used is Enneking, to stage them as benign or the malignant. For tumor, it is Enneking staging. Now, for fractures around the ankle, right? Fractures around the ankle, they are classified by Log-Hansen classification. It is Log-Hansen classification. Okay. Other one which is important here, in the feet of a child, when you talk of the child, in the feet of the child, we have one more classification that is known as Pirani classification. And you know why the Pirani is being followed. Pirani is followed, which is divided into basically 3 scores, 0, 0.5 and 1. So if everything is 0, everything is fine. Everything is 1, the deformity is severe, right? That is Pirani classification, which is used for CTV, to assess the severity of the CTV. Okay, if you have if you have a child who has got a epiphysis here, the physeal plate injury, the physeal plate injury is classified by Salter-Harris classification. That is Salter-Harris classification. Okay, so these are some of the common classification systems that you can remember for the exam that you are going to have day after tomorrow. So these are some of the classification system. I've been getting this message again and again to just summarize the common classification system which may be MCQs in the exams. So these are few. If you haven't heard of a few of them, like this one, Log-Hansen, or the Frickman-Fernandez, or the Bedo, or basically the Cierne-Maeder, or the Arlett-Fickett, nothing to worry about. You already have read more than enough from orthopedics. It is a short subject, and I believe whatever you have read till now is going to come in your exams. It will be very, very easy paper, right? So all the best to all of you. This is how we classify or we learn some of the common classification systems. Thank you very much.